Dr. Nabarro, were you taken back by the Prime Minister's comments, or is this something the pros have known forever, that the pandemic would clearly stretch well into 2021?
I'm afraid the pros have been saying this, and they are saying it will stretch on into next year, and we don't know when things are going to calm down. I'll explain why. This virus is a tricky, dangerous, but also alarmingly persistent virus. It's not one of those viruses that softens over time like we've seen with some influenzas. Coronaviruses generally stick around. And what we've seen is that it's also actually advancing quite slowly across communities, even though the numbers of cases increase rapidly. It's not spreading right across a whole nation like wildfire. So there's an awful lot of people still to be infected in our world, even though we know that more than around 30 million have been infected. So it basically means that the virus is here to stay. It's going to keep moving across the world. It will return back to places which have managed to get the number of cases down. And the only way we can deal with it is by actually learning to live with it as a constant threat and making sure that we get ahead of it and defend ourselves against it.
I've got 8 ways to go here, Doctor, but let me go to the constant threat that's theirs right now. The basic threat seems to be to shut down our global economy. Does the World Health Organization suggest that given the virulence of this virus, that we really do have to shut down economies?
No, that has never been the position of the World Health Organization. And I'm super sorry that sometimes that's how it's presented. We state the following: countries can live with this virus provided they put the defense mechanisms in place. And as far as we're concerned, living with the virus means continuing with economic and social activity. There will be some alterations that are necessary, but that should not mean shutting down whole economies. Instead, we say, find the middle path where you control the virus and at the same time you enable economic activity to continue. I can describe it to you. It's quick, but I think it's really important I get that headline across to you and your listeners.
But David Nabarro, to put the right restrictions in place, we need to understand the virus. And there's so much about this virus that we don't understand. Why are some people asymptomatic whilst others not? And is mask wearing the only way to protect us and others?
Thank you. Yeah, well, of course, this virus is brand new. We've had 8 months or so to study it. There's a huge amount of research underway. There are things we do know. Let's just start with how you protect yourself against being infected and how also you might be able to reduce the risk that you could pose to others. 5 universal precautions. Physical distancing is number 1. Try to stick to the 2 meter or 6 feet rule. Secondly, mask wearing. It is particularly useful when you are unable to physically distance. We don't know how totally effective it is, but we do know that those who wear masks are less likely to infect others and to be infected themselves. Thirdly, hygiene. Hand hygiene, cough etiquette, and keeping services clean. Fourthly, isolating ourselves when we are sick with the symptoms of this disease, or indeed in more general sickness symptoms until we know that we don't have the virus. Fifthly, we have to make certain that those who are most at risk are protected. We call these the universal precautions. Tedros, the Director General of WHO, says, do it all. Last point, yes, there are people who appear to be able to transmit this virus even though they don't have symptoms, particularly in the day or so before they actually start to experience illness. Now, this is a problem, but our general view is that it's not an absolutely widespread problem, and it does add to our wish to ask everybody to practice physical distancing, masking, and hygiene as basic activities that should be done by everybody.
So this is a very important point. How many people are asymptomatic, either pre-symptomatic or sick with COVID-19, but will never show symptoms? Do we have a percentage of that, and do they shed the same amount of virus as people that are coughing?
Complete answers to that question are not available, at least from me. The various studies that have been done suggest in the UK, for example, that the level of the population who have the virus without symptoms is really quite small. However, studies in Iceland and studies, for example, from a cruise liner that was moored outside of Japan, suggest that over time you can actually get an increase in asymptomatic transmission. And some African studies have also come out with higher numbers. That means I won't give you a percent. I'm sorry. And I think if I do give a percent, I'll end up saying something that will irritate somebody. I don't want to do that.
Dr. Nabarro, you and I are old enough to remember the miracle of Salk and then Sabin with the oral polio vaccine. You and I remember lining up in school with mothers very emotional over the miracle of these drugs. Why are we having so much difficulty explaining to people when the vaccine shows up, it's basically an act of science and God?
Well, do you know that even though we've had these wonderful vaccines against polio, despite the most extraordinary effort with money and political backing, we still have not managed to eradicate the polio virus. It's really annoying, actually. We've also got a wonderful vaccine against measles, which is a pretty nasty disease, especially in undernourished children. We've not managed to get even a significant chunk of the world's children immunized against measles. There is a strange and quite widespread anxiety about vaccines that's not based on science. It's based on an overarching nervousness about the use of the body's biological properties to defend people against disease. And we're seeing this level of what we call vaccine hesitancy climbing in our world day by day, alongside a number of other quite tricky theories that people have got, particularly about the coronavirus. Our current view is that this is what tends to happen when people are super scared and need to actually find individuals or institutions to blame. And we're doing everything we can to encourage world leaders to stop fanning the seeds of these conspiracy theories, because they're not helping us at all.
Do we understand, Mr. Nabarro, why some people get sick and others don't? And as soon as we understand that, is that almost, even more important than getting a treatment for those who end up in hospital?
The trouble with this virus is that it actually is capable of attacking different parts of the body of any individual, and the way in which individuals defend against this virus is quite varied. And that's why I keep having to say to people, it's a really cunning and nasty virus. Of course, it is well known that older people and people with diabetes or high blood pressure are at risk. But I'm sure you've heard that there's about 1 in 20 people who don't die as a result of the disease, but they also don't recover very quickly when they've got it. I know people who are getting constant fatigue, who are getting shortness of breath, and who even are getting heart trouble. And often these are active sports people. So we really can't start saying this is a virus that's trivial. We've got to say it's a virus that's nasty for everybody. And lastly, we've got to recognize that sometimes the reaction of the body to the virus is what actually causes illness.
Dr. Nabarro, we've got to leave it there.